Not in calf. Now what? 4 weeks after the start of the insemination period, every cow should have been inseminated at least once. Check the animals if this is not the case. Check the animals if this is not the case. The 3 main reasons for not being in calf. In addition, the records may be wrong, and or the animal may not yet turn out to be in calf. In addition, the records may be wrong, and the animal may yet turn out to be in calf. Anestrus not seen in heat. Non-active ovaries occur mainly in cows that have lost a lot of condition. The ovaries are small, as are any follicles and corpora lutea that are present. As are any follicle and corpora lutea that are present. The uterus doesn't contract or contract weakly. If the cow has active ovaries, you can wait until the next heat. Usually it is also possible to use injection to include heat. See page 41. So you know she will be in heat around 3 days later. Anestrus not seen in heat. Non-active ovaries occur mainly in cows that have lost lots of condition. The ovaries are small, as are any follicle and corpora lutea that are present. The uterus doesn't contract or contracts weakly. If the cow has active ovaries, you can wait until the next heat. Usually, it is also possible to use injection to induce heat. So you know she will be in heat around 3 days later. Cysts on ovaries are degenerate follicles or corpora lutea longer than 2.5 centimeters. The cow is usually not seen in heat. Sometimes she comes into heat irregularly, sometimes constantly. Persistent heat, nymphomania, male-like behavior. Due to the complexity of the subject, diagnosing cysts and choosing the appropriate treatment are a job for your vet. Never burst cyst rectally. This results in bleeding and damage, which may lead to adhesion and infertility. Ovary with cyst. Ovary with reasonable well-developed follicle. Ovary with cyst. Inflammation of uterus. Endometritis. In a closed infection of uterus, the uterus contains pus. The cow is healthy, does not come into heat, and may have an occasional discharge. Rectally, an enlarged uterus with thick liquid contents can be felt. A corpus luteum is present, possibly in the ovary attached to the smaller horn. On rectal palpation, therefore, endometritis feels very similar to a pregnant uterus. Treatment involves injection to induce heat. Concurrent treatment with antibiotics is of little added benefit. This picture indicates the cross-section of uterus shown in the ultrasound image. This ultrasound image shows the cloudy contents of a uterus with endometritis. The amniotic fluid of a healthy embryo is always clear. An experienced eye will also notice a thickened uterine wall.